Dr. Lakin Veera. I am a general laparoscopic and laser surgeon associated Apollo Group of Hospitals. Today we are going to talk about surgical complications and emergencies. So what exactly are the two emergencies I am going to be discussing today? Something which is very common. We see in an outpatient basis nearly every day. Topic number 1 is appendix and topic number 2 is hernia. So appendix. Well, appendix, to be actually speaking, it's a very easy topic because it's very common. I guess each and everyone in your family, in your relatives or in your nearby surroundings must have someone who has got an appendix problem, appendix surgery or something related to it. What I would like to today emphasize with this short video is regarding the emergency associated with it and few complications that usually happen with it so that you get a better idea. What basically is appendix? Inflammation of the appendix region which is just next to the cecum. When it's inflamed, it's called acute appendicitis. Over the last many years, the cases of acute appendicitis has slightly increased. Most of my patients' first question is always, "Sir, kyun hua hai? Why have I got this appendix?" To be very honest, even now, there's no straightforward, clear idea of why appendix happens. What is the nomenclature which usually is given is small fecolids, small areas of feces which get stuck at the base of the appendix, causing it for reduced blood supply and inflammation. What are the symptoms usually patient comes with? We have something called as a modified Alvarado score for it. The common things that we see is pain, fever, nausea associated and vomiting. It usually classically starts in the umbilical region, then it radiates and migrates towards the right iliac fossa region. Do you really need any investigations? Because many of the patients keep coming and say कि नहीं सर आप बोल रहे हैं अपेंडिक्स है बट हमको सोनोग्राफी कराना है, सीटी स्कैन कराना है. To be very honest, we were always taught and were told to follow the modified Alvarado score, where if it crosses 9, where you have all the classical signs and symptoms, that is pain, fever, nausea, vomiting, raised WBC, migrating RIF pain, to be honest, you don't require much investigations. But in today's day and age, it is always better for the patient where even their relatives are satisfied. We usually go for a sonography or in some cases a CT scan. Usually it's very easily diagnosed as acute appendicitis. Treatment is straightforward. Laparoscopic appendicectomy. Now, there's always a controversy which has happened over the last many years. Laparoscopy or open, laparoscopy or open. To be honest, to all my patients who I see in OPD, I always give a laparoscopic option first. There are 1-2 advantages that we really are going for. That's why we think about laparoscopy. In laparoscopy, what we basically do is the first step is we take a small incision here and we put a camera inside. With that, what happens? I get a very good visualization and idea about the complete bowel. I can check the bowel right from ileocecal junction to DJ. I can check for any small meckles. I can check for any other problems which are associated around any inflammation, and if anything is there, I can pick that up, take photographs and guide the patient regarding in post-op also. What the surgery done is laparoscopic appendicectomy. It's a very straightforward 1.5 hour surgery. Post-operative stay is usually only 1 day. Next day patient is home. We usually start liquids little slowly in case of appendix because inflamed. We have chances of nausea, vomiting post-op and patient goes home after 1 to 2 days. Problem that I've many times faced, सर पेन तो बहुत थोड़ा है, अपेंडिक्स में ज़्यादा ऐसा इशू नहीं लग रहा है. मेरे घर में आजू बाजू में भी 1-2 लोग थे, दे हैड अपेंडिक्स, सर उन्होंने गोली से ठीक हो गए. टू बी ऑनेस्ट, आई गिव अ वेरी क्लियर आंसर फॉर दैट. what treatment what they were undergoing that time was absolutely correct, because in case of mild cases, I completely agree. Just simple painkillers, good antibiotic for 3 to 5 days, the inflammation will subside. But that is short term. Your appendix problem is going to come back. What I tell my patients is, आप appendix को भूल जाएंगे, वो आपको नहीं भूलेगा. It is going to come back. It usually comes back after around 4 weeks to 6 weeks. The problem here is, it comes back in a more scarier way. The pain is more. There is more high-grade fever, vomiting, and chances of complications also, which I'm going to talk at the end. So I would suggest to everyone, if you're getting an inflamed appendix, infection in the appendix region, please don't delay it, because there is no way you're going to get out of it with only tablets. Even if you do, it is temporary. So it is always better to just get your checkup done and discuss with your doctor regarding the surgery first. No medical treatment for appendix ever. It is always surgical. Now, what complications I was trying to imply? See, two common complications that we have seen in majority of patients who delay discussing about it, delay surgery or some other reasons. One is appendicular abscess. Second is perforation of the appendix. Now, what exactly happens? We all have a slight idea appendix is a long tubular slender structure, usually around 3 to 4 centimeters. When inflamed, it may go up to 8 centimeters also. What happens? The tip perforates. Now, when this tip perforates, what exactly is the problem that happens? See, it is all intra-abdominal. So there is bowel around it. There is omentum around it. If it gets stuck out there, then the surgery itself becomes complicated. Many times it is stuck to the cecum. Complete excision and removal of the appendix becomes a problem because it is stuck to the surrounding bowel. We can't make a hole in the bowel. So what happens is, that is one reason why we ask for earlier admission, earlier surgery to avoid these kind of problems of appendicular perforation. Lastly, coming to abscess. Now what happens? Suppose it is a month of January, you've come with appendix issue and you don't want to get it treated. You wait till February, you wait till March. Intra-abdominal, there is microorganisms which are there. There is an inflamed appendix that stays out there, and especially if in diabetic patients, little old age patients where the immunity is little lower, infection starts. That infection surrounds that area and there's a good amount of abscess which happens, which not only makes your surgery difficult, also it causes high grade fever, severe pain, and a simple straightforward surgery becomes a complicated one and your recovery becomes delayed. For a laparoscopic appendicectomy, usually we have surgery and patient post-op day 1 discharge. 3 to 4 days he is back to working in office. In case of appendicular abscess, appendicular perforation and such, we have 7 days to 14 days where patient needs to take rest at home. So my whole idea today with all of you friends is to discuss, don't take appendix lightly. One other example that I always give my patients, once appendix is diagnosed in your family, in your friend circle, please take it as a priority. Because if taken on a priority basis, treatment is fast, smooth and recovery is very nice with absolutely no long-term problems. 1-2 other problems that some of my patients have asked is, sir appendix तो अतड़ी है, अतड़ी का भाग है, आप उसको निकाल देंगे, कोई प्रॉब्लम नहीं, कुछ उसमें कुछ होगा नहीं. So that is what I wanted to address also is, see, appendix is something called as a vestigial organ. It is a waste organ. I have an appendix, you have an appendix, we all have it. But does it do any function? No. So is it safe to remove? Definitely, it's absolutely safe to remove and there's no issues with it. Okay. Thank you so much, and we'll just come to the second part of it.